The Presidential Task Force for the Control of Coronavirus says it is yet to receive any money from the funds donated by the private sector towards the fight against COVID-19 pandemic. Alhaji Lai Mohammed, a member of the committee and the Minister of Information and Culture, disclosed this when he appeared on News Agency of Nigeria Forum to give an update on the activities of the task force in the fight against the pandemic. Mohammed expressed dismay over reported calls by some non-governmental organizations seeking the probe of the task force over the deployment of monies gathered from the donations.
Well, I can say without any fear of contradiction that as of this moment, the task force has not received 1 penny from anybody. The only money that we won't be able to account for probably will be whatever money we receive from the federal government. Because the private sector, especially the Nigeria Economic Summit Group led private sector, has said, look, they are not going to give 1 penny to the task force. They will raise the money, they will ask us what our needs are. Okay. And already we have compiled what our needs are. Right now, what the task force needs most is to get enough facilities, especially for those who might test positive. Make no mistake about it, there's going to be a spike the next few days in the number of people that will test positive. But that should be no cause for alarm. It's natural. And the more testing we do, the better for everybody. So what we need now, like I say, is we need bed facilities where those who have tested positive will come. We don't want a situation whereby there will be no bed space because this is an infectious disease. And please, when people test positive, it depends on the stage. If it is mild or moderate, it doesn't need to go to a hospital. It can still be managed at the isolation center.
The minister said that apart from equipment such as the testing machines, ventilators, and personal protective equipment, the task force is working to ramp up training of personnel to handle these equipments.
So our challenges are bed space, PPE, personal protective equipment, training. We are ramping up our testing capacity. Last week we had just 5 laboratories all over the country. Today we have 7. And by the end of this week we are going to have 10. We are also ramping up, training of personnel along the same line. And we are very hopeful that 2 other private laboratories will come up in 2 weeks' time, which will add an additional 5,000 capacity daily to our testing. And if our experiment with the Gen Expert machines come through and we're able to convert their cartridges, then we are going to have about 500,000 capacity of testing.